So why is it then that someone gets a bill in the mail if they have a Medigap Plan G? So here's the way this works. Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid making Medicare mistakes, and above all else, get the most out of your Medicare benefits. Now, today's topic is Medigap Plan Gs and unexpected medical bills. Now, before I get into the details of this, let's just do a quick review. When someone goes on Medicare, they have two different options or two different ways they can use their Medicare benefits. You cannot be in both of these systems at the same time. It's one or the other. One way to use your Medicare is to stay in original Medicare A and B, and people who do that typically get a supplemental plan to fill in the gaps in original Medicare A and B. The other option is to get an Advantage plans. Those are called replacement plans or Part C plans. And so those are your two options. You got to be on one or the other. So obviously in this video, we're talking about those who have chosen to stay in the original Medicare A and B system and buy a Supplemental Plan G. Now, when we stay in original Medicare A and B does pay pretty well, but it doesn't pay for anything 100% except preventive services. So when someone is getting something that's non-preventive service, a diagnostic evaluation or some type of a healthcare service, non-preventive, then they're going to have some kind of financial liability, something they'll be responsible for financially. We call that a gap in coverage. And basically, there are 3 gaps on the A of Medicare, the inpatient side, and 3 gaps on the B of Medicare, which is the outpatient and doctor-related service. So we have these 6 gaps. When someone buys a Medigap Plan G, that Plan G, buy that through that private health insurance company, is going to cover 5 of the 6 gaps. It's almost full coverage, but not quite. And so we have a G plan and everything is covered except the Medicare B Deductible, and that is once a year. And the B Deductible this year, 2022 is when I'm shooting this video, that B Deductible is $233. Now, if you're watching this in 2023 or 24, certainly is going to probably be a little bit higher than that. They raised it up a little bit. But the point is, if I have a Medigap Plan G, 5 of the 6 gaps are covered by my supplemental plan. I'm responsible for 1 of those, all right? And so the question is, if I have that Medigap Plan G, why would I be getting a bill? And so there's actually 3 questions we have to ask ourselves when we get a bill on a Plan G. The first question is, have you met your Medicare Part B deductible yet? Because remember, every year we've got to meet whatever the Part B deductible is. That's something established by Medicare, approved by Congress. This year it's $233. So I'm not shocked if we get a bill for $233 because we're responsible to meet the B deductible. So the first $233 of bills that are coming to the B of Medicare, all outpatient services and all doctor-related services, we would expect we're going to get a bill up to $233. Now, depending on what your claims are going to look like, I don't know where that $233 are going to be billed from, but it could be a couple doctor visits with labs. Let's say your first claim is cataract surgery. Well, you'll pay the first $233 and then you're done for the year. Let's say you have an MRI or a CAT scan, very expensive test. You'll pay the first $233 and then again, we're done for the year. So the reason we get bills initially is I have to pay my B deductible. So the first $233, I'll be billed for that. It's coming to my mailbox. I'm going to have to pay that. Then after that, I have 100% coverage. As long as Medicare pays, that G plan pays everything but the B deductible. So that's the first question. Have you met it yet? You're going to have to do so. Number 2, if you're getting a bill, let's say you have met your deductible. Why are you getting a bill? Well, it could be because that bill was not coded correctly. You went to the hospital, or you went to the doctor, or something happened, and when that file, file was claimed with Medicare, what happened was they didn't bill it correctly. They didn't code it correctly. Everything today is tied to the codes. We have a new coding system started a few years ago. There's about 80,000 codes. So occasionally things are miscoded. So that provider, hospital, doctor, whoever it was, filed that claim with Medicare, and Medicare didn't like the coding that was used. And so what happened is they denied the claim and they sent it back to the provider. Now you're getting a bill, maybe for the full amount. And so how do we correct that? Well, we call the provider and say, this should have been a Medicare covered service. It looks like to me it could have been coded wrongly. And so can you check the coding? And if it was a wrong code, no big deal. That claim can be refiled with Medicare. And now if it goes right, Medicare is going to pay that claim. So again, we'll see people getting bills because of coding errors. And those are easily corrected, one phone call, and they just simply refile the claim. Or it could be, last option, you have to ask this question, was the service that is being billed by Medicare, and now they're billing me for the full amount, was that even covered by Medicare? Now, folks, Medicare covers almost all services, but there are some services they're not going to cover. Let me just give you just an easy example. If you go to a chiropractor, Medicare only covers at the chiropractor's office acupuncture, 12 treatments a year, as well as the adjustments to the spine. Nothing else. So if you went to a chiropractor and that chiropractor did x-rays or maybe some other kind of therapy beyond the adjustment, then you're going to be 100% responsible for that. So you may be getting a bill for something that Medicare says we're simply not going to cover. Medicare covers things very, very well, but if it's something that they're not going to cover, then you will get a bill for that full amount because that supplemental plan does not have to pay anything that Medicare did not pay first, because that's the way supplemental plans work. Medicare pays, and they have to follow filling in the gaps based upon the letter that you purchased. So sometimes people get bills because they had something done that Medicare did not cover, and then you would be responsible for it. So all the Medicare supplemental plans really pay well. G is the most popular today, and so occasionally you will get a bill. So those are the questions that we're going to ask. Number one, have you met your deductible? Number two, is this something that Medicare should have covered and just didn't? Or is this something that may have just been miscoded? And again, that's a very easy thing to correct. Hey, thanks so much for watching the video, and I do hope that it was helpful. Now, if you feel like you need to learn more about Medicare to make sure you're making the right Medicare decision, really the best way and the easiest way to do that is to go to MedicareSchool.com. That's MedicareSchool.com, and you'll be given the opportunity to click on Get the Free Workshop. We call that the Essentials Workshop, and I do all the teaching, and there you'll learn all the ins and outs of Medicare to make sure that you have an accurate and thorough understanding of how Medicare works. The second thing you can do is click where it says Talk to a Medicare Guide, and there you can actually set up a time where you can discuss your situation with a Medicare guide. They'll explain all your options, and they'll actually even walk you through the enrollment process as well if that's what you need to do. And so go to MedicareSchool.com, watch the workshop, or talk to a Medicare guide. It would be our privilege to assist you further.